analysis mandates, how to do a risk analysis, enforcement requirements, and the consequences of non-compliance. And this is based upon a toolkit solution that HIPAA Integrity has provided, and I'll talk a little bit about that at the end, and then we'll take your questions. I'm going to go through these slides, as I said, pretty quickly, but the compliance objective for HIPAA and HITECH Act is to secure protected health information so it's not impermissibly accessed, disclosed, or used by unauthorized persons or processes. And this is accomplished through a number of regulatory requirements. The first and most important, and the foundation for the remainder, being conducting a risk analysis, identifying strategies for risk mitigation, implementing policies and procedures, training workforce members on those safeguard policies and procedures, and documenting activities, actions, and assessments, and over time maintaining ongoing vigilance that those safeguards work. Protected Health Information, PHI, is comprised of 18 identifiers of a demographic nature that apply to medical records of any type. These are names, dates, addresses, other information that would lead to the identity of a patient or dependents. PHI can be in hard copy, electronic, or oral. The HIPAA privacy rule covers all three of those. The HIPAA security rule, which we're going to concentrate on, really covers only electronic PHI. And the electronic media and systems that contain that PHI. Safeguards are nothing more than rules and actions that fulfill three foundational properties: protecting healthcare data and information related to it in an electronic format. First is availability. The information is accessible and useful upon demand by an authorized person. For example, a physician can get your medical record at any time. Integrity. The information has not been altered or destroyed in an unauthorized manner. It's represented as being what the authorized person has included in it. And confidentiality. Data or information is not made available or disclosed to unauthorized persons or processes. And persons covers in the federal definition corporations. It has a wide variety of meanings besides just being the individual. To achieve these properties, healthcare providers, covered entities, healthcare providers, health plans, and healthcare clearinghouses and their business associates must mitigate risks to electronic protected health information, and I'll refer to that as EPHI throughout the presentation, and all of the network systems, application devices, and media in which it resides, which would be databases, data at rest, and in transmissions, data in motion, as it's known. The legislation enabling regulations, the HIPAA Administrative Simplification Rule was passed in August of 1996. The HIPAA Privacy Rule went into effect in April of 2003, and the Security Rule 2 years later. In February 2009, the HITECH Act, Health Information Technology for Economic and Clinical Health Act, which was part of the so-called stimulus bill at the time, was passed. It included, for the first time, specific rules on breach notification. The interim final rule was published in February of 2010, and the HITECH Act modifications of not only that rule in final form, but privacy and security rules was passed in January 25 of 2013 and required compliance by September 23rd, 2013, so just over 2 years ago. The key provisions in the HITECH Act, it required business associates to implement the HIPAA security rule, administrative, physical, and technical safeguards, just as a covered entity would. It expanded the definition of a business associate to include subcontractors as business associates, and subcontractors as business associates are only contracted to other business associates, not the covered entity. And it required covered entities and their business associates to report breaches to the Office for Civil Rights, the Department of Health and Human Services. It increased materially the penalties for noncompliance with the HIPAA HITECH Act safeguard provisions. We'll go over that in a bit. In addition, the HITECH Act created what's known as the Medicare and Medicaid Financial Incentive Program for adoption and meaningful use of certified electronic health record technology. We're going to only focus on a very small part of that, and it's the Stage 2 security measure. CMS, Centers for Medicare and Medicaid Services, has just released Stage 3 rules, but those are beyond the scope of our discussion. So we will focus on the Stage 2 security measure, and it's related to HIPAA and the HITECH Act. Safeguards are administrative, technical, and physical, and they also apply to business associates in covered entity specified privacy provisions in the business associate agreement or contract. So the security safeguards for a business associate must be implemented the same way a covered entity would. The privacy provisions are specified by the covered entity, and they may be very limited to whatever the scope of services the business associate is responsible for. The key provisions under the HIPAA privacy rule are designating a privacy official, implementing and documenting administrative, technical, and physical safeguard policies and procedures, and that was included in the privacy rule, which preceded the security rules implementation. Also, training workforce on standards, applying sanctions, and mitigating harms from violations. Many of these, once the security rule went into effect, were included there as well. Covered entities and business associates, contractors, and subcontractors are required to implement the security rule, as I said, and it applies to covered entities and their business associate contractor. There's only one business associate agreement between the covered entity and a contractor or business associate, and all other subcontractors contract downstream and hierarchically with one another as needs arise. All must be under a business associate agreement. Key provisions are implemented through policies and procedures based on standards and implementation specifications. And safeguard choice is flexible as long as performance results are attained. The most important and the foundational aspect of these safeguards is the written risk analysis, which has to be periodically reviewed and updated as business operations or regulatory changes warrant. And all policies and procedures and actions, assessments, and activities related to them must be documented and retained for 6 years from the last action taken. I'm going to go through the next set of slides fairly quickly. It's to give you an idea of the specifications, and it'll show how we have constructed the risk analysis that you would conduct. There are 9 standards and 22 implementation specifications for administrative safeguards. The first in the security management process is the risk analysis. It requires assigning security responsibility to what's called a security official. There are provisions related to workforce security. These are all as bullets. Or if, for example, the second assigned security responsibility, there are no specific implementation specifications, but that is required to be implemented as well as an implementation specification. Going on, it covers information access management, and I want to give you an example. This first sub-bullet, isolating healthcare clearinghouse functions. Very few healthcare providers or health plans are going to have that function. While you're still required to address it, it's sufficient to indicate not applicable, which would be written and documented. Continuing down, our the second set here is security awareness and training of the safeguards, reporting on security incident procedures, having a whole set of contingency plans. These relate to availability, one of those key foundational properties, evaluation, and then business associate contracts and other arrangements. Those comprise the administrative safeguards. Physical safeguards, there are 4 standards and 10 implementation specifications, and facility access controls, controlling access into a building, for example, having locks, those types of things. Workstation use and workstation security, how those are accessed and controlled for access. Device and media controls, what happens when you dispose or reuse and have backup for your data. It's important to go to this citation, what we call the guidance for rules on disposal. Redaction using a black marker is not acceptable as a disposal method. We recommend, given that media are relatively inexpensive and getting more so, not to reuse, but to destroy media that contain EPHI. Technical safeguards, there are 5 standards and 9 implementation specifications. Access control to information, audit controls, checking how electronic data are tracked, integrity of the information to authenticate the data, authentication of persons who have access who are authorized to deal with the information, and transmission security. Integrity controls the accuracy of the information that's moving, and then encryption to protect the data in motion. Earlier, there was data at rest in this category as well. Each of these implementation specifications have to be addressed in a risk analysis with regard to the data and with regard to each of the IT systems that you would have in place. So the critical points here are to remember it's appropriate encryption for data at rest and data in motion is also specified in that document, guidance to render unsecured protected health information unusable, unreadable, or indecipherable to unauthorized individuals. It's at that, it was promulgated beginning in April of 2009. It hasn't changed. It's available at that URL. And I'm not going into breach in this webinar. I'll cover that in a subsequent one. But there is a safe harbor for breach notification if EPHI is encrypted. And this is important to note, particularly with the large number of lost portable and mobile devices that contain EPHI. We're going to look now at the risk analysis mandates. And the first one here, the first bullet, risk analysis, which is required to be conducted, conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by a covered entity or business associate. And then you have to implement security measures based on the findings. There are 2 other specifications, sanctions and review, but they're beyond our scope here. We also have, and it's related to the HIPAA security rule in the meaningful use security measure, and this covers data that would be in an electronic health record, which are, as you're well aware, over the last 4.5 years, the federal government has given incentives, financial incentives to the tune of $26 billion to healthcare eligible professionals, hospitals, and critical access hospitals to implement that technology. This is the stage 2 measure. You can see the underlined part was added for stage 2, so the non-underlined would be the stage 1. And it's to use the same HIPAA risk analysis process and to verify when you attest that you have put those security safeguards in place. In this case, with respect to your electronic health record, EPHI. So what is risk? Why is this important? It's a measure of the extent to which an entity is threatened by a potential circumstance or event, and typically a function of the adverse impacts that would arise if the circumstance or event occurs and the likelihood of occurrence. So that's very broad. In the context of HIPAA and high-tech, it's the potential occurrence of an event that has an adverse financial impact. The Ponemon Institute, which does an annual survey, in fact, one was released yesterday on the news, but this came out in May. And if a healthcare organization has a breach, the average cost could be as high as $363 per affected individual. Those would be the records based on that annual survey data. And those costs include remediating the harm, which is required, notification to affected individuals into OCR, also required, and the impact of lost business. Information security risks. This is, again, based on the National Institute of Standards and Technology's definitions, but it's the risk to organizational operations, assets, individuals, other organizations, and the nation due to the potential for unauthorized access, use, disclosure, disruption, modification, or destruction of information and information systems. And then, again, a subset is looking at really focusing on the systems. So here's the definition of a risk assessment. It's identifying those risks to organizational operations across the board, organizational assets, individuals, other organizations in the nation, resulting from the operation of an information system. Part of risk management incorporates threat and vulnerability analyses and considers mitigations provided by security controls planned or in place. So a risk assessment is, and again, this is in this definition, is synonymous with risk analysis. And in the HIPAA legislation and enabling regulations, both are used synonymously. There are 9 key activities in a risk analysis, and I'm going to go through each of those and define the activity, and then what are the basic steps underneath that. This is a representation of what we have at HIPAA Integrity have created in a tabular format, considerable more detail than I'll go into here. And I'll come back to that at the end of near the end of the presentation. But again, these are based upon recommendations from NIST, and they really reflect what would typically be done in a risk analysis. So the first is to define the scope of your risk analysis pertaining to your covered entity or business associate's physical environment. into your electronic networks, servers, databases, applications, stationary and portable devices, removable and backup media, and transmission media that contain or use electronic protected health information. I've underlined physical environment because you have to do this for each physical facility that you have. And if we go back and look at those implementation specifications for physical safeguards, you have to look at locks and other protections in a building, how you would recover if you had more than one facility, how you would recover through a disaster recovery and retrieval of EPHI. It's very important to note that if workforce members telecommute and are authorized to access and use EPHI in a work environment at home, this is increasingly the case. You still must address each such work environment as a separate physical facility. Here are the steps to accomplish activity 1. You have to identify the location, contact information, number of workforce members, and a responsible person who's usually going to be the security official for each physical facility that has IT systems that contain EPHI. If there's more than one physical facility, you need to assign a unique identifier to each so that you can distinguish between these. If there's an investigation related to a complaint or a breach, whether at the federal level or at the state level, which is increasingly becoming the case, you need to be able to show a risk analysis for a particular location. Then, for each physical facility that has IT systems that contain EPHI, you have to identify each electronic IT system and whether it contains EPHI. So we're talking about an inventory here. So once you complete that inventory, you want to write a brief statement of the scope of the risk analysis, highlighting the regulatory requirements, indicating the number of physical facilities that are involved, the workforce members in each, and the prevalence of IT systems that contain EPHI. And then your risk analysis is going to address, through the subsequent activities here, threats and vulnerabilities related to each of the IT systems that you've identified. In activity 2, we're going to identify and compile relevant information pertaining to creation, receipt, maintenance, processing, and transmission of EPHI for each IT system unit by type. This is going to be the most time-consuming activity for a covered entity or business associate that has not created an inventory of its electronic IT systems. And I have done that for clients, and I can tell you it's very time-consuming if they haven't already identified everything they have that has EPHI, either stored or moving through it. If updated on a regular basis with deletions and additions of electronic IT system units, your organization will facilitate the HIPAA security rule required risk analysis reviews and updates going forward. So it's very important to, once you do this, if you haven't already, to maintain it going forward carefully. Here are the steps. For each IT system unit by type, the value of 1 from activity 1, create an inventory identifying model serial number, where it's located, and give it an identifier, who is the responsible workforce member for it, the vendor name and contact information, and whether policies and procedures to safeguard EPHI are in place. So for each IT system unit by type, defined in the preceding bullet, you'd create an inventory describing its functionality vis-a-vis EPHI, creates, receives, maintains, processes, transmits, or any combination thereof. And then the security official would approve this, and you need to make, in addition to whatever copies you would use internally, You need to copy each inventory onto 2 flash drives, store one in the safe deposit box for further risk analysis use, place the other in the custody of the organization's attorney. These inventories are important for cyber insurance purposes and future risk analysis review and update processes. And we'll talk about the increasing market enforcement that's being driven by cyber insurance carriers. So steps 1 and 2, if you could do a 3-dimensional matrix, you could combine these, but you're probably going to want to, and that's why I suggested the identifier. You're going to want to do these in 2 different sets of tables, and that's how we've done it in our software. In activity 3, you're going to want to identify and compile relevant information pertaining to threats to the creation, receipt, maintenance, processing, transmission of EPHI. Threats are anything that can have a negative impact on EPHI, whether intentional, being malicious intent, or unintentional, such as misconfigured server or data entry error. Threat sources are natural, human, or environmental. And probably the most important thing, and I've stressed this in the books that I've written, the most critical thing you have to worry about with electronic systems is continual availability of electricity supply. This is critical to ensure that you meet those availability properties of the HIPAA security rule. All right, so for each IT system that you've identified earlier with a value of 1 from activity 1, which means you have EPHI, you're going to identify threat sources in 4 categories: malicious intent, accidental, structural, and natural disaster that would impair access to workforce members to your organization's IT systems containing EPHI. Let me give you an examples in each of those categories. Malicious intent would be from a workforce member, outsider, or terrorism. Accidental could be a workforce member, IT administrator, building contractor, or business associate if you're a covered entity. Structural could be electronic IT system equipment, temperature and humidity, electricity supply, or software. And natural disaster could be fire, flood, tornado, or wind and hail, hurricane, or earthquake. So for each identified threat source in each category, you're going to rate the likelihood potential from 1, least likely, to 10, most likely for that occur. So if you're in the middle of the country, for example, under natural, least likely to occur would be a hurricane, most likely would be a tornado, and similar depending upon where you are locationally. So from the information described in the preceding bullet, you'd identify the top 5 threat sources to organizations' IT systems generally and to each component specifically. And from the information described in the preceding bullet, you would identify potential threat tactics, techniques, and procedures, adversarial or non-adversarial, and indicate what current security measure, if any, is in place to mitigate the identified event. In activity 4, you would identify and compile relevant information pertaining to potential vulnerabilities to the creation, receipt, maintenance, processing, and transmission of EPHI. So one way to look at this in a broad sense is a threat would be generally from an external event. A vulnerability would be a weakness internally. That's not always the case, but that's one way to look at it as you go through this. So vulnerability is a flaw or weakness in a system, security procedure, design, implementation, or control that could be intentionally or unintentionally exercised by a threat. So a threat occurs, it finds a vulnerability, and you have a security incident. So it's easy to confuse these. That's why I suggested setting up kind of an external, internal organization. An organization may be vulnerable to damage from power spikes. The threats that could exploit this would be overloaded circuits, faulty building wiring, dirty street power, too much load on a local grid. So it's important to separate these two terms in order to figure out what type of security control you're going to select and implement. So in this particular example, they could range from installing UPS systems, additional fuse boxes or standby generators, or rewiring an office. So these additional controls could help mitigate the vulnerability, but not necessarily for each threat. So it's also important as you go through a risk analysis to always ask the question, is the EPHI going to be available? Is it going to be unaltered? And is it going to be confidential to authorized users? Here are the steps in Activity 4. It begins with a link between risk analysis findings, HIPAA security rule, safeguard policies and procedures. This is really where this starts, linking identification of a threat or vulnerability to your controls to mitigate it. So you'd create a 4-column table here, where column row represents implemented safeguards for each administrative, physical, and technical implementation specification. That's why I went over those quickly, but you have to, in those rows, include every one of those to be compliant with the rule. In column 2, for each one of those implementation specifications, using information compiled previously in Activity 3, you'd assign 1 if a safeguard is implemented, otherwise assigned as 0, which would be a potential vulnerability. In column 3, if safeguard equals 1 in column 2, you'd list your current security measures by code, which we have coming in the next activity. And you would label column 4 if safeguard equals 1, but the current security measure code's not listed is not listed in 3. You'd list the code in this column. So you'll see that in a minute. So in Activity 5, you want to identify and assess the current security controls that your organization has documented and implemented. So each of these builds upon preceding information compiled. Here are the codes, 5 codes. Risk analysis has been conducted and periodically reviewed, safeguard policy in place, enforced, procedures in place and enforced. Workforce members are trained on those safeguards, and you have periodic evaluation. So a thorough understanding of these controls for a covered entity or business associate will reduce the list of vulnerabilities as well as realistic probability of a threat attacking your EPHI. So here are the steps. Using the table created previously where safeguard was 1 in column 2, you assign 1 or more of the security control codes in column 3 for each implementation specification that describe current safeguards. In column 4 of that table, where safeguard equals 1, you would assign the omitted security control codes in column 3. So you might have 3 in the 3rd column and the remaining 2 in the 4th column. And the entries in column 4 represent the vulnerabilities in areas that your organization may have considered as secure. For example, you may not have conducted a risk analysis pertaining to particular implementation specifications, so that would become a vulnerability. So for each security control in number 3, you're going to compile the written documentation that describes the safeguards you have in place. If it's not found in your organization or in your judgment does not provide sufficient security control, you're going to color it red, denoting a deficiency or potential vulnerability. In continuing, you're going to address the red security controls once you've identified them all, and any potential vulnerabilities that may impact the confidentiality, integrity, and availability of your organization's PHI. So what you have are existing security things that you may not think are up to the task, and any other vulnerabilities. That's what you've identified here. You're going to document in writing those deficiencies and vulnerabilities, and look at how you may revise those to accommodate a remedy. So when this process is complete, when you've gathered all the information, you're going to then change all those red security controls in column 2 to green in a new corresponding table. So activity 6 is then determining the likelihood and impact of the threat, exercising a vulnerability that would affect your organization's electronic media and information systems. So first of all, you've looked at where you have weakness. Now you're looking at the probability of something happening in this area. So here you're going to create a 5-column table for each implementation specification. And you're going to identify in column 2 where you had a 0 previously, and fill in each corresponding cell of activity 6 with a 0. And then you're going to label columns 3 and 5 as affecting loss of confidentiality, a loss of integrity, and loss of availability, if applicable, in 3 through 5. And then you're going back and look at the threat sources and identify the most likely threats affecting confidentiality, integrity, and availability for each one of your systems. Activity 7, you're going to determine the level of risk to your organization's electronic media and information systems containing PHI. So what you're going to do here is apply, and this is based on judgment. You've compiled all of the relevant information. Now you need to make a assessment of the probability of this happening. And you would use this color coding scheme in each one of the tables, the activity 4 table, and you would color it as such. So you want to identify what's going to be a low probability of occurring, what's moderate, and then really focus on the high areas. So you're going to recommend in activity 8 security controls and measure to mitigate risk levels that your organization has identified that are reasonable, appropriate for its business operations. And those can be done based upon what the regs permit, the size, complexity, and capabilities of your organization, its technical infrastructure, the cost of security measures, and probability and criticality of potential risk to EPHI. So if it's very low risk, but you've identified a weakness, you would not want to spend a lot of money to try and correct that. In an area where you have a very high risk, and again, we look at continuity of electricity supply, you might want to consider a generator or some sort of backup. If you're a physician practice, for example, and you have your records all electronic, you can't get to them if the electricity is gone. So the steps here, you've completed all your information gathering. You now need to modify your safeguard policies and procedures to fit your particular operational environment to risk that is acceptable. So you would create a 5-column table where the rows are each of the rules and assign the risk levels recommend new security controls or measures, expected date of implementation of policies and procedures, and get the security official to sign off on it. And then 9 is make sure all your recommended security controls and measures are incorporated in safeguard policies and procedures. That means implementation. Train your workforce members on those safeguard policies and procedures. Protect your risk analysis in a secure location in written or electronic form. Each is permissible. Remember to consider the HIPAA privacy rule administrative, physical, and technical safeguards as they apply to all PHI. And for healthcare providers in meaningful use, you may use this documentation that you've done through the risk analysis and then implemented through policies and procedures to attest with confidence, as well, as long as they have looked at the electronic health record systems and safeguarded those, but you need documentation, burden, and proof. So now we move into enforcement, and there are really 2 areas in enforcement related to this. The first is the federal level at OCR, which handles breach notification, privacy, and security rules. The HITECH Act empowered state attorneys general to bring actions in federal court relating to breaches on behalf of protecting their state residents. And the consequences of a violation, the first case brought was in Massachusetts in 2014, and there was a settlement of $150,000 regarding a breach. So in each of these cases, the individual organization, whether it's a covered entity or business associate, is accountable for conducting a risk analysis, implementing risk management program, training workforce members, imposing sanctions for violations, and documenting all actions. That's the enforcement within the organizational environment. The penalties under the HITECH Act were raised and are quite severe, and particularly for this 4th bullet in the first category, which is a mandatory $50,000 per violation if a violation is due to willful neglect and not corrected as required. And the maximum is $1.5 million in a calendar year for repeat of the same violation. Before the HITECH Act, the violation was $100 per, with a calendar maximum of $25,000 on the same basis as I said earlier. Perhaps the most important enforcement agent now is the cyber insurance market. And cyber risk means any loss, any risk of financial loss, disruption, or damage to the reputation of an organization from a failure of its information technology systems. It includes business risk. As of May 1, 2014, your commercial general liability policy, which most people keep for liability, specifically excluded under insurance service office policies, excluded coverage of any costs related to HIPAA breaches in almost all states. I think it's up to 48 states now. When this was passed, it was 47 states and the District of Columbia. So the series of high-profile data breaches, and this is from a analysis in Business Insurance in May, has hit companies in sectors ranging from retail to healthcare, and has helped to clarify the need for these dedicated cyber insurance policies. Recent breaches, such as on Anthem, have caused underwriters to intensify their scrutiny of cyber risks. I've been involved with the insurance industry for 20 years, and we're a preferred provider to one in particular. But what we have found and what we are urging, because of over $6 billion in losses since 2009, the underwriters are requiring written evidence of cyber risk mitigation strategies, including a risk analysis, in order to underwrite coverage of breaches going forward, and this is becoming increasingly common. So that highlights the importance of the risk analysis. The consequences of noncompliance, you can go to this website that the Office for Civil Rights maintains. These are settlements. To date, there have been no violations that have been penalized. They're all entitled as mutual settlements for violations. This particular one was between New York Presbyterian Hospital and Columbia University Medical Center for HIPAA violations. Each reported a breach, I believe it was in 2010, 2011. But in the investigation, and all breaches of this type are investigated, they found, you can look at all of this and go out online and read these in full. Each is about 10, 12 pages. Failed to implement processes and security measures sufficient to reduce the risks and vulnerabilities. Failed to implement appropriate policies and procedures. The Columbia violations: failed to conduct an accurate and thorough risk assessment, failed to implement security measures sufficient to reduce the risks, etc. $3.3 million was a settlement with New York Presbyterian, $1.5 million with Columbia. In a more recent, going back to that case, the corrective action plans, and these are onerous in terms of time and commitment of resources by the settlement party. They had to conduct a thorough risk analysis within 188 calendar days, and all of these have to be approved before you can move to the next stage. Come up with a risk management plan, revised policies and procedures, and then you're on a probationary status for a while. The second agreement was last month, $750,000 for a laptop bag that was stolen from a car. And this happens more than you can imagine in terms of EPHI on portable and mobile devices that are lost or stolen. And again, what we'll talk about in the subsequent webinar, focusing on breach, is this safe harbor if you encrypt your data. But they found, in this case, no risk analysis, no policy on removal of devices with EPHI in and out of a facility. The corrective action plan, you had 90 days to do a full risk analysis for review, etc. So corrective action plans in general, very quickly conduct a risk assessment, get a risk management plan in place, policies and procedures, evaluate the impact of any risks. In other words, review and update your plan, train workforce members, and put periodic reports into HHS for compliance. So what I have talked about today, we have encapsulated in a software product that goes from the very beginning foundation, the risk analysis, and beginning in January 2016, actually in January 25, which will be the exact third anniversary of the final high-tech acts, we're adding training that all tie together in a set of tables. So the first is a risk analysis template designed for self-assessment. We've written all the safeguard policies and procedures. There are 92 of them, and they can be tailored because we link the risk analysis to the policies and procedures. We've included 22 required forms, a lot of guidance and references that are all available online. And with the product, we designate, we include the organization designated name in every document, and that immediately takes you out of the willful neglect, not corrected liability stream. You still have to implement everything, but at least you're on the road to beginning to do that. As I said, we're adding the training tools in January 2016, and we've been working with the Electronic Network Accreditation Commission, ENAC, expect accreditation later in the year. One of the reasons we're doing that is several states that we're working with have asked us to look at deemed compliance status, whether it be with regard to training or with regard to risk analysis, and this is also an interest of the insurance industry. So you can get more information on that at the website if you're interested. So again, just to recap before there are any questions, you got to designate your privacy and security officials, conduct that written risk analysis, implement safeguard policies and procedures, train your workforce members on safeguard policies and procedures, and maintain written documentation of safeguard actions. And with that, I'll pass it back. Thank you. If there are any questions.
Thank you very much, Ed, for that very informative presentation. Got a few questions here just to let everybody know. The recorded webinar link as well as the slide deck will be sent to all registrants following the live webinar. First question, is there a specific level or type of encryption that is required or recommended for use with protected health information?
Yes, and if you go to the URL for the guidance that I cited in the presentation, it will tell you exactly, and they're all NIST-based documents that are available online. It'll tell you exactly what level of encryption is required for achieving that safe harbor of safeguarding EPHI.
Thanks. The next question, do we have to do a risk assessment for paper charts?
It's not specifically required, but imagine, if you will, in the privacy rule, they have administrative, physical, and technical safeguards. So imagine, if you will, you're walking into a physician's office, as we all have, and you see rows and rows of files with paper information in there. You want to consider that as part of your risk analysis if you still have those paper files under physical access. Similarly, oral communications regarding PHI are covered under the privacy rule. So you would want to come up with a policy and set of procedures about not talking loudly or not talking in front of non-authorized persons about such information.
Next question, how do you recommend handling virtual servers in terms of physical identification?
If you are using the cloud, which I believe is what you're talking about, someone is providing that information or that connectivity and data storage. I've covered that in HIPAA Plain and Simple in the 3rd edition, which is a book available at Amazon. It's really the same rules that you would put in place in dealing with any business associate. They need to prove to you that they're maintaining that information according to security rule provisions, and any transmission of that information is secure in the data in motion perspective.
Does a business associate need a privacy official? I think the regulation just says the security official and security rule. If so, what regulation says a business associate needs a privacy official?
It doesn't specifically say that, but in terms of the privacy, the business associate definitely needs a security official. because they're required to comply with all the security rules. The covered entity agreement with a business associate is the covered entity will specify the privacy provisions in the work that they're assigning to the business associate. And if the business associate, who's the contractor, has subcontractor business associates, those same privacy provisions have to be in all of those business associate agreements going downstream. So the security official, if they're very limited, the security official, say you're just doing some sort of processing on EPHI for the covered entity, the security official would pick up the requirements for privacy. And there is no provision that precludes a security and a privacy official being the same individual.
So that wraps up about all the time we have today, but I want to thank all of the attendees, those that asked some more specific questions. I'll make sure that Ed gets your questions and can follow up with you after the webinar. Another question, will you also provide us with an example column table for clarification along with the training slides? That's up to Ed. Ed, would you like to address that?
Yes, if you go to our website and register, you can download examples of, there are examples of each of the risk analysis, the policies and procedures, and the breach notification requirements. And if you have specific interests beyond that, you can contact us at HIPAAintegrity.com.
Thank you very much, Ed, for this very informative webinar, and thank you very much to all of the attendees. Just a reminder, I will be following up with you after this webinar to send you the slide deck as well as a link to the recorded webinar if you'd like to watch it again if you missed part of it or would like to share it with your colleagues. Please feel free to do so. So thank you, Ed, for joining us, and thank you to all of our participants as well. Enjoy the rest of your week.